Hello, Dr. Karan
Hi,
Thakur.
Disha.
Thank you for joining us today. Dr. Karan
My
Thakur
pleasure.
is the Vice President, Public Affairs of Apollo Group of Hospitals. And today I want to talk to you about something that's very pertinent and very relevant in today's scenario. So, as somebody who heads the administration of one of the largest hospital groups in India, how do you see the issue of trust in a world that is trying to recover from the pandemic? Do people trust hospitals today?
Yeah, I think it's a very profound question at many levels. One is that trust, even before the pandemic, if you look at medicine, you look at healthcare, I think the bedrock relationship is of trust. I mean, if you don't trust your doctor, your healthcare provider, and vice versa, if a doctor does not trust their patients to follow through on treatments, it will not have the outcomes that one wishes for. But more specifically to trust and mistrust, I think it's been a troubling trend that one has noticed, and not just around the pandemic, but this precedes the pandemic, when there has been a general sense that medicine has become too commercialized. It is driven with motives other than the benefit of the patient. And I think that has generated a sense of mistrust between patients and doctors. And I think that's a very regrettable move or scheme of things. More specifically, if you look at what happened during COVID, doctors were also struggling. The healthcare fraternity itself was struggling to find the right answer, to find the right treatment. And in that groping, there were many treatments which were bandied about. Many worked, many did not work. But in the minds of people who were really struggling at that time and looking towards doctors for a solution, they sometimes felt that doctors were trying to push things that they knew did not work or know will not work. Whereas one has to realize that the medical fraternity was itself caught up in the storm and had never seen anything like this before. So has the problem of mistrust increased over the past few years? I would say yes. Has COVID made that any worse? In that time, at that moment, yes, it has. But one would have to see how this pans out in terms of a relationship between doctors and hospitals and patients, because the flip side is a lot of people saw healthcare workers very differently as well. They saw them as heroes, and I'm sure that that did move the trust quotient up vis-a-vis healthcare workers. So one would have to see now how post-pandemic, I think we are out of it, how that relationship works.
Interesting that you should bring it up, because I think initially you looked at a doctor as a god.
Yes.
You thought he knew all the answers. And somewhere when you humanize them a bit, you can empathize with them as well.
Correct.
There are studies that say about doctor burnouts being at an all-time high
Yes.
during the pandemic. So as a hospital, what did you do to ensure that your doctors had a safe working environment?
Yes. So safety, I guess, during the pandemic was paramount. I mean, when people were being, they were happy being locked up at home, their freedoms taken away. We had very young people who had just gotten into healthcare coming out there and, sort of really having to deal with human emotions, turmoil, trauma that not even them, but many people, probably the generation that fought wars, would have seen. And that was incredibly tough on people. And I do know a lot of colleagues, doctors, nurses, healthcare workers, who actually quit the profession or they moved closer home. And that is understandable because of the emotional trauma that they went through. But more specifically, I think what you said, doctors and healthcare workers were taken as gods, but they were humanized in this. And as an organization, one had to see them for what they were, not what we expect out of them. And it was okay for them to express their feelings. It was okay for them to skip a day. And one was allowing that, other than structured help through some fantastic work our mental health teams did with our healthcare workers. There was some unstructured support also that was given. And this is apart from all PPEs being made available, equipment and so on and so forth, the infrastructure being redone so that it was a safe working environment for them. But I think it was just standing right behind them. And the feedback that I'm an administrator, I really can't call myself a frontline worker, but what they felt happy about was that, look, you were at least standing next to us when this was going on. So I think it fostered deeper bonding between frontline workers and administrators who have had a tenuous
Yes.
relationship, in healthcare.
Right, right. It's interesting that you should mention mental health because many a times when we are talking about mental health, we don't talk about doctors being the recipients or having to need that. So, how do you think? Do you think there's still stigma attached to that, or are doctors more open to seeking mental health?
I think one of the greatest tragedies around mental health has been that how many healthcare workers actually struggle with mental health, and how small or how few a number actually seek out help. And a lot of this has to do with normative behaviors in healthcare. You're expected to do long hours. You're expected to see human emotions, going awry. You're expected to sort of just embrace looking at a person dying, let's say. But we are all made differently, and I think it's good that we don't have that attitude anymore towards healthcare workers. But a lot more needs to be done. I think we've just scratched the surface. It's a much bigger, larger problem that we have just not dealt with. If you think about a young nurse who comes far away from home, very young, moves into a strange new city or a country, and is having to struggle with a working environment in which there's death, pain, struggling with your own emotions. It will play a part in your own mental health and well-being, but it's not been dealt with enough, and I think that should change.
Absolutely, absolutely. We are hoping that it changes for the society
Yes.
as a whole.
Yes.
And tell us, Dr. Karan, like you have a medical background, and then now you're working in the healthcare setup, and you are very vocal and very articulate with your views. We don't see that with a lot of medical professionals. Do you see a way in which that can change? Do you see a need for doctors to be more vocal and more articulate and more accessible to people?
I think, Jisha, this goes back to your first question, which is about trust. I think if we are going to humanize doctors, we will have to let go of this paternalistic attitude that healthcare traditionally has had, where you tell the patient and the patient is expected to just sort of nod and move on. And that can happen through doctors becoming more accessible, as you've said. Obviously, physical accessibility is limited, but through social media, through more open dialogue, through more interaction with civil society, social institutions. Doctors have done that, but I think it has been more personality to personality rather than profession to profession. And I think there are encouraging signs, though. I mean, if you go on Twitter or if you go on Instagram, there are a lot of doctor practitioners who are putting out good information, who are presenting their views, and let's hope that there are constructive views as well. It should not just move towards wanting change, which is fine. But I think for every reform, we must also think of what challenges we need to undertake ourselves and change ourselves to ensure that those reforms come about. So the early days, but I'm happy to see more doctors talking about issues that go beyond just their profession.
Yes, absolutely. Absolutely. And Dr. Karan, tell us, what is it that you get excited about work? What is it that you're looking forward to in the coming days, months?
Yeah, I think sometimes the storm gone by is just a relief. I think we've just all taken a breather in our professions. Seeing what has happened and what could happen to you. A certain bit of invincibility that healthcare folks had about themselves has gone out of the window. But looking ahead, I think. And I don't mean to sound negative, I'm saying this with a positive. There is this looming challenge of climate change and the vagaries of climate change on diseases. And I think personally speaking, and I think for the larger fraternity, it's time to look at that big challenge, because if COVID was any indication of what one virus can do, the entire global health changing because of climate change is something that we don't have the wherewithals to manage and get our arms around. So I think that's the next big thing that presents a challenge, and I am personally excited. Excited may sound like a positive word for a very negative situation that one is facing, but I think it's good to start looking at that and becoming prepared for it.
Yes, absolutely right. At least people are addressing it and it's there on the agenda. Thank you so much for taking
Thank you,
time.
Shah.
It's been a pleasure chatting
As
with you.
always, thanks for having me.
Thank you.
Thanks.